So what exactly is SCAD and how is it different from other types of heart attack? SCAD stands for spontaneous coronary artery dissection, and it refers to a unique type of heart attack where instead of having a cholesterol plaque, a hardened cholesterol plaque, rupture within an artery and block the artery off, which is the traditional type of heart attack, SCAD actually involves the dissection or tearing of the wall of the artery. As the tear forms between the layers of the wall of the artery, a blood blister, which we call a hematoma, can sometimes form within the wall. As that blood blister or hematoma grows, it can block or obstruct the inside of the arterial wall, and this sharply cuts off or impairs blood flow to the heart muscle. And this is what we call a heart attack itself. Spontaneous coronary artery dissection, unlike the traditional heart attack, or I should start calling it the atherosclerotic or plaque-based heart attack, tends to affect more women than men. Out of every 10 patients who have SCAD as the mechanism of their heart attack, 9 out of them will be female. Now, typically, there are some risk factors for the atherosclerotic or plaque-based heart attack. And those risk factors often include things like high blood pressure, diabetes, elevated cholesterol, smoking, etc. However, with SCAD, these usual traditional risk factors do not apply. In fact, with SCAD, there are often female sex-specific risk factors that tend to play a greater role. We know that there is an association between SCAD and hormones, female hormones, in particular, times of great hormonal change. So some of the risk factors for SCAD include things like pregnancy itself and the postpartum period, menopause and the perimenopausal period, oral contraceptives containing estrogen, hormonal replacement therapy, especially hormone replacement therapy that is taken in a pill form, that is estrogen-based, IVF or in vitro fertilization / assisted reproduction and the hormones that are required for it, and in some cases, a woman's natural cyclical changes in their hormone levels, including during the time of menses and thereabouts. This is quite different than the atherosclerotic or plaque-based heart attack. Now, as far as the incidence rate, SCAD is still deemed uncommon because it makes up for only 4% of total heart attacks worldwide, and thus it's in some avenues referred to as a rare cardiac disease. However, when you break that down into women, particularly women under 50, SCAD accounts for about 35% of the total proportion of heart attacks in this group of women. And of course, for women who have heart attacks during pregnancy or postpartum, SCAD is the #1 cause of their heart attacks.